Alrighty, everybody. Thank you so much for joining us this afternoon. This is our second ever Public Health Power Hour, and we're so excited to have Miss Khadija Amin from Black Health. And today she is going to talk about social entrepreneurship. As an entrepreneur herself, she owns a very amazing nonprofit here in the local Atlanta area. And I know that she'll be able to talk about a few things as well as give you some great tips and pointers about how to start something of your own should you ever want to start something of this magnitude. So I will hand it on over to Khadijah and let her take the lead.
Awesome. Thank you for the introduction and so excited to be here in this virtual community with you all. And I hope you all stay safe. Glad you all have voted already. Is everyone able to see my screen? Awesome.
Yes.
So we'll get started. And again, today's Power Hour presentation will be focused on the intersection of social entrepreneurship and public health, and a little bit more about me and the organization that I co-founded, Black Health. So I am in I'm at Georgia State University School of Public Health right now in the Department of Health Policy and Behavioral Sciences. In the PhD program, I'm graduating this December. And outside of school, I co-founded, along with four other former public health students, a nonprofit called Black Health. Black Health is a Black-led, Atlanta-based nonprofit focused on advancing health equity in Black communities in Atlanta, across Georgia. But we also do some national work through anti-racist education, advocacy, research, and programs. Um, and really core to the work that we do is a recognition that racism and not race is a root cause of poor health outcomes that Black populations experience. So we lean on a very expansive evidence base that links racism as a fundamental cause of systemic differences in health that Black populations experience. So we're really focused on identifying and intervening against racism's harm on the health of our community. And a little bit more about what we do. Our work can really be placed into two buckets. So the first is our external facing, community based efforts, and those include national public health campaigns. We have three different community health event series, and we offer a lot of digital health communications. And all of that community facing work is intended to break down barriers that Black communities experience in accessing health promoting education, resources, services, and conditions. And we also, on the other side, do a lot of internal facing work. So internal capacity efforts focus on equipping the current and future health workforce with the tools to identify and intervene against racism's harm on Black communities. And so we do that through anti-racism workshops. We have a fellowship program we just launched around health equity advocacy, Black Health Cares. We do a lot of strategic advisory, technical assistance to different health systems, academic health institutions around ways to more equitably and responsibly work with Black patients, care partners, research participants, etc. And a little bit more about how we got started. And I had hinted at this earlier, but myself and the four Black Health co-founders met almost a decade ago in our School of Public Health. So we all went to Emory University down the street from us. And we met through our shared interests and engagement with student activism, student organizations on campus. So we were all in our Black Public Health Student Association, and doing a lot of work around educating on the connection between race, racism, and Black health. At the time as well, so this is like 2014 to 2016 that we were in our master's program. We heard, witnessed vicariously a lot of high profile cases of police brutality against Black women, men, and children. So this was a similar period to like 2020. And at the time, we and a lot of other Black public health students, allies were very vocal about that connection between police brutality, anti Black racism, and public health. And so upon graduating, we really wanted to carry on the work that we were doing as public health students and really translate our training and education into action, into more community facing work. So that's how we landed with Black Health. And now I'll segue a little bit into why social entrepreneurship and what the connection between public health and social entrepreneurship is. And throughout the rest of this presentation, I'll leap in some examples from my organization. We identify as entrepreneurs. We are a nonprofit, so I'll explain a little bit more about that throughout the rest of the presentation. But why social entrepreneurship is because social entrepreneurship and public health are very similar efforts. So they're both mission-driven endeavors focused on making a positive contribution to society and to social good. Really core to public health is making a sustained impact at the population health level, and social entrepreneurship in general across sectors that sustain population level impact is also central. And social entrepreneurship is really focused on innovative, outside of the box approaches to improving social and health outcomes, which is really what public health does and what you all are being trained on. I want to start with some pros and some cons just to consider as you think about or are maybe currently balancing social entrepreneurship. I know nowadays social entrepreneurship can seem really enticing, and a lot of people have critiques of 9 to 5s, but I wanted to give a fair assessment of the true pros and cons as someone who's very deep into the social entrepreneur nonprofit world. So I'll start on the positive and some pros, and something that really just drew me to wanting to do this type of work is that you really have more control over the strategic and programmatic direction of the work that you're doing, which allows for room for innovation. If you recall on the previous slide, innovation is really core to social entrepreneurship, but also we have so many public health challenges that we're facing. And so getting to ideate and come up with ideas and pursue funding and then implement those ideas into improving public health is really exciting. Another positive, and you'll also see this on the con side as well, is the more flexible, typically more flexible work hours and work location. So a lot of social entrepreneurs are engaged in work um, outside of 9 to 5 hours, or there's more flexibility and control over your work hours. If you're working for yourself, as long as you're achieving those deliverables. And there's also typically some more flexibility around the work location you're at. So a lot of social entrepreneurs are engaged in remote work or hybrid work, which for some is a positive. And then something that like really like gravitated me towards social entrepreneurship, but I know this is the same for other career paths like consulting, which can fall under social entrepreneurship, is that your day-to-day looks different, which I'm someone who needs to constantly be stimulated and have like new work that I'm working on to really get me thinking and excited about my work. So I appreciate that variety. Although I know that's definitely not a preference for everyone, so something to consider. And then I want to be realistic and provide you all with some of the um, not so fun parts of social entrepreneurship as well. So, one of the challenges, particularly if you're new to social entrepreneurship, you're starting, you're at a smaller organization, is growing your capacity to navigate and afford benefits like health insurance and retirement. And those are things that larger organizations, if you're joining, already have all of those HR, human resources capacity set up. So that's definitely, particularly financially, something to consider. Um, Something to consider if you are interested in the nonprofit side of social entrepreneurship. But this is also true if you work at a nonprofit that you didn't co-found, is just being within what's called the nonprofit industrial complex. So while there is some more creative control over the type of work you do and the strategic direction, you are ultimately beholden to funders and need funding to sustain the work you do. So often have to be very flexible to funders' priorities, which really strips you of some of that control. So that's something that I'm actively learning and navigating as well. And then something that folks I wish talked about a bit more about social entrepreneurship is like the not so fun side, that you're not just getting to do the exciting, innovative public health, social impact programming all the time, but at least half of what you are spending your days on is administrative tasks, the behind the scenes running of a business, which for some is exciting and interesting. For me, that's one of my least favorite parts of social entrepreneurship. But I will say, from like a positive lens, that it does provide you some additional skill sets outside of what you learn in formal public health training. So you learn kind of how to run a business, you learn about human resources, you learn about legal aspects and financial aspects. So you do build some additional skills, but it's not just all the fun public health programming you're doing. And then lastly, on this slide, I just wanted to offer um, just a reality around the limits to not working a 9 to 5 job. Um, is that particularly when you're at a smaller organization, you're actively growing it, you're working on both the programming and the business administrative side. It takes a lot of time. I'm often, very often, working nights and weekends. Um, Particularly like a lot of nonprofits, like social impact entities are doing community facing work on evenings and weekends to make that work more accessible. So we're always having events on weekends and working through the night, which is challenging and definitely can lead to um, just burnout. There's a lot of literature resources around there around entrepreneur burnout, nonprofit burnout. So, yeah, just wanted to provide that realistic lens. And then I will now jump into some of the nuances between types of social entrepreneurship paths. And how my screen's displayed right now, I can't see anyone's comments, but if you have any comments, feel free to drop them in the chat. or come off mute, and I'm happy to answer throughout the presentation, and then we'll have plenty of time at the end as well. But I wanted to start with the first potential path you can think about, which is the for-profit side of social entrepreneurship. So this is more typically, particularly for like small businesses, someone like with a public health degree will look like limited liability company or an LLC. And I will share some of the benefits and drawbacks to that particular for-profit business structure, and just like a little bit, like very high level, how you can pursue that structure, what that looks like. So, some of the benefits to going the for-profit LLC route is that when you have a for-profit company, unlike a nonprofit, you are not limited in your ability to generate revenue through providing goods and services, which, particularly if you are thinking about offering services like fee for service, or you're selling like goods, that's could definitely be a benefit. And then something else that is a benefit is that for-profit entities are able to take investments. So this includes anything from like investments from your like peer group and friends and family to if y'all have heard of like venture capital and like angel investors. So as a for-profit entity, you're able to take in those investments. And then, particularly like a LLC, a smaller LLC, it is less of an administrative burden and like reporting burden compared to a nonprofit that I'll explain on the next slide. But a major drawback to the for-profit route, if, for social entrepreneurs, is that you're limited in your eligibility for grant funding, particularly like government and foundation grants. Um, because as a for-profit entity, you cannot provide a tax deduction. And that's something that is for a lot of funders, they prefer not to give out funding if you can't provide that tax deduction. Particularly because we're in public health, a lot of funding for public health activities is grant funded. And not all grants are limited to nonprofits, but a lot of them are. So that's something really to consider is your funding source if you're thinking about an LLC or for-profit entity. And then as a for-profit, unlike a 501(c)(3) nonprofit, because you're not tax exempt, you do have to pay taxes. And then just really quickly in terms of just the filing and fees that you have to consider, and I contextualize this to Georgia. It's each state is different, but the fees are similar in each state. But to become an LLC, it's a one-time filing with the government. So your state government, so in our context, Georgia Secretary of State, to formally register your LLC. And that is, the last time I checked, that was $100, and that's one time. So it's not, it's actually pretty easy to get an LLC. And then the other option to consider if you're thinking about social entrepreneurship is a nonprofit. Black Health is a nonprofit, and I'll explain a little bit more about that in a second. Um, the most common structure that you'll likely be looking at if you're thinking the nonprofit route is a 501(c)(3). There are also other structures like 501(c)(4)s that do more like policy, like advocacy related work. But most commonly, if you're thinking about social entrepreneurship, public health, you'll likely be looking, if you're thinking of a nonprofit, the 501(c)(3) route. Some of the benefits to being a C3 nonprofit is that Unlike for-profit entities, this really opens you up to be able to apply and be eligible for a lot more grant funding. So including those government and foundation grants, and as I mentioned before, in public health, a lot of our funding's grant based, so that's a huge benefit. And as a 501(c)(3) tax exempt entity, you both do not have to pay taxes because you're providing a public good. And you also are able to offer a tax deduction to donors, which is an incentive for both individual donors, but also can be incentive for like larger like corporations as well. But some drawbacks for the nonprofit route is that there are limits to the amount of revenue you can generate because, again, the purpose of a C3 nonprofit is to be serving and providing a public good, not to generate income. That does not mean that you cannot make money as a nonprofit or make like a decent salary as someone working at a nonprofit, but um, it's just the nature of the tax structure. And then there are a lot more governance and reporting requirements for a nonprofit. So to get that tax exempt status, there's you have to have a nonprofit board of directors. So that's something you have to establish. You have to have bylaws. There's ongoing annual reporting requirements you have to do. So from your annual registration to what's called a Form 990, and regularly doing audits as well. And then as a C3 nonprofit, you are, unlike a C4, you're limited in your lobbying activities. That does not mean that you can't engage in activities like advocacy. And Black Health does do a lot of advocacy. So there aren't limits on the advocacy piece, but and then finally, in terms of just like the forms and fees process for a nonprofit, establishing one, it starts with a one-time government filing fee to the IRS. And this will either be in a form 1023, or if you're applying as like a larger entity or like a more complex entity, or for like smaller nonprofits, the form 1023 easy. And so those are for that first form, last time I checked, $600 and 275 for that shorter form. So you file that to the IRS. It can take months for the IRS to then review your application. And then the IRS will send you a letter of determination, if you to let you know if you're granted that tax exempt status. And then, as I mentioned, you're going to have to continuously every year report. So send that your annual registration form to the state, which is $30, and then file your Form 990 every year. And just I'll go over this quickly. These are more complex structures. So particularly if you're getting into social entrepreneurship, you likely won't be uh engaged or operating under these structures. But there are also blended models. So these are hybrid structures that combine elements of a for-profit and a nonprofit. I'll say the one that may be most relevant to you all, if you do end up thinking about a blended model, um, is the umbrella nonprofit model. So there are cases where there's a larger umbrella nonprofit that serves as the primary, like 501(c)(3) legal entity. And then under that nonprofit, they then support smaller, like community coalitions, community-based organizations that themselves don't have a C3, but they're able to operate under that umbrella. And then that umbrella nonprofit is able to provide that what's called fiduciary, like legal, accounting, fundraising support, and those community organizations underneath it are able to um, share knowledge and resources and different services. Um, and there's also like a parent model. So like a nonprofit um, is the main like parent entity organization, and then a for-profit is a subsidiary like under that nonprofit. And then like brother sister models where organizations may have like separate like nonprofit and for-profit entities. But again, those are more complex. There are also like different public-private partnerships that exist between for-profits and nonprofits, like separate entities. But um, again, I don't think any of y'all would really be looking into this outside of that umbrella structure. And then some just considerations now that I've gone through like the differences between for profit and nonprofit. Again, in your decision, if you're interested in social entrepreneurship and trying to decide what business structure makes the most sense for you, you really want to think about both your source of funding and type of work you'll be doing. So if you are interested in pursuing those like federal, like governmental grants, funding from different foundations, and a lot of foundations fund public health work. Um, or really thinking you'll rely a lot on like individual donors, then I would definitely consider that nonprofit 501(c)(3) route. But if you see yourself doing more fee for service work, which I'll get to in a second, so that may look more like public health consulting. If you're like working like by yourself, it's just you, I would definitely consider the for-profit structure instead. It's less burdensome. And then something else I just want to highlight is that engaging in social entrepreneurship does not have to be a one person endeavor. So for example, my organization, Black Health, there's four of us that came together as co-founders to establish the organization. And I would not have been able to do any of this work without my co-founders. So having that peer network and support has been great. So if you have anyone in your network that is also thinking about social entrepreneurship and you're interested in similar things, definitely consider working together. And then if you choose one route, so let's say you choose the LLC route, you can always transition later. And you can like file for that the 10 what's it called? That 1023 filing form. You can file for that once you're already LLC if you want to convert. And that's actually what Black Health did. Um Black Health, we got established like right after we graduated, so in 2016, and we started as an LLC. And that filing process was like super easy. But just like we were just getting started, it made more sense for us to be an LLC. Um, but as we started doing work, we realized that just the type of work we were doing, because like fee for service was only like a small bucket of the work we were doing. We're doing a lot of just like community facing work, a lot of free events that we're coming out of pocket for. So we decided to convert to a file and convert to a C3 nonprofit, so we can get more diverse funding sources to support some of our more community facing work. So now we're able to and have funding from a diversity of funders. So we have government and foundation grants, awards. We have a few corporate sponsorships, pharmaceutical sponsorships and grants. We still do some, particularly like with our technical assistance, strategic advisory, some fee for service contracts and subcontracts, and then we also have individual donors as well. I think I just saw a comment pop up. Um, because of how my screen is set up, I can't read the comment.
I can read it for you.
Okay,
It
thank
is from Miss Mia Robinson. She said, I wish this session was available when I started my nonprofit. It has been an impactful learning experience and has led me to consider public health consulting due to the networking I've been able to do and possibly do away with the nonprofit. I struggle with that decision. Maybe you have some advice for her at all?
Well, thank you for sharing. And I will say, like, I wish I had a presentation like this or this knowledge before starting as well. Because like on the flip side, like we wouldn't have started as a LLC, we would have started as a nonprofit, but I've heard like the opposite as well. And this is just something like we've been around at this point for 8 years and we've just like learned on the ground on the go. But I'm so grateful that GSU is doing this session and we're doing something on social entrepreneurship and in general, like it seems like there are a lot more public health folks that are interested in social entrepreneurship. And I'm hoping both through different like career service departments across schools of public health, but also like um through like student organizations, through curriculum, we're able to embed some of this information more. But I'm glad this has been helpful so far. And actually, yeah, speaking of consulting, so public health consulting and contracting is a great way if you're interested in getting into social entrepreneurship. And I know a lot of people that are public health consultants, either just themselves or they've formed like a little collective of public health practitioners to provide services. And this is definitely a great option to think about. This is also something you can do, and this is on a later slide, but um, as like a like part-time job. So you can have like your stable 9 to 5 job with your all your benefits. Um, and do like public health consulting on the side. So this is definitely something to consider. Also as like public health trainees, you all like we are actively being equipped with a lot of translatable skills and tools that different organizations would be interested in advisory on. So I just included like a short list, but there are a lot of more things that in public health we're being equipped around, from program planning and evaluation to health communications to curriculum development and facilitation, um, things around data analytics, health informatics, strategic planning, grant writing, quality improvement. Like these are all tangible skills that we're being equipped with as public health future current public health practitioners, that you can translate into your own business. And then in terms of clientele, if you establish your own public health consultancy, you can be a contractor or subcontractor to government agencies, nonprofit entities, healthcare systems, academic health institutions, private sector companies. So there are a lot of potential clients that would be interested in the skill sets you're being equipped with. And just some advice I have for getting started in public health consulting. So the first is identifying your skills. So based off of the coursework you have, some of your practice-based experience, identifying some areas of expertise that you're starting to build up, as well as areas that you actually like really like and are passionate about. So like for example, I love teaching. I love like designing just like curriculums and getting to facilitate them. So that has become like an offering that's embedded in Black Health's work. So really identifying that nexus between your expertise that you're being equipped with as a public health student practitioner, as well as your area of interest. And this can also be outside of public health. So if you want to start a consultancy with some skills, experiences that you have outside of public health, this is all applicable as well. And then you want to start like building a potential client base. And so this involves like the public health community is so small, and particularly in Atlanta. But we're lucky to be in Atlanta. There's so many, really are like a public health capital. So there are a lot of opportunities here. So continuing to go to networking events, continuing to go to these power hours, um, and different opportunities that the career services um, at Georgia State is offering you, as well as like leveraging your social media platforms like LinkedIn and X to communicate the work you do. In order to do that communication, you can think about creating a one pager. So this would be like separate from your CV or resume, but just like a one pager that really explains like who you are, your areas of interest and your areas of expertise and what you can offer in that one pager. And you could distribute that on social media. Invest in branding. So really develop either yourself, like if you're creative, artistic, like you use Canva or like Photoshop, I don't know, or partner with someone who does do um branding work, a graphic designer to help you come up with your like logo and your color palette and your branding, the feel and aesthetic you want to give off. Um, and also, I highly recommend once you have like your business name and logo, to get that trademarked ASAP so no one takes it from you. Um, and then from the for-profit, like social entrepreneurship consulting side, definitely look into if you're eligible for any federal or state certifications, because this can open you up to be able to take on more contracts, or different types of contracts. So this includes things like you could be like certified as a small business, a minority business, a veteran-owned business, a woman-owned business. So look into those different certifications to see if you would be eligible for any of those and apply to that. Um, and then, as I mentioned, like way earlier, like the beauty of social entrepreneurship is that it's flexible and adaptable, and your work looks different day to day. And so staying abreast with just like latest public health healthcare trends, changes in policies, practices, changes in like decision makers, leaders, innovations, because that will impact the type of work you do or what you offer. So just being aware of that context. And then this is one of my last slides. So it's 1010% okay if in general, after hearing this presentation, you're not interested or not ready for full-time social entrepreneurship. And I want to offer just like some alternatives or like ways that kind of get your foot in the door, or just ways to get involved in social impact work without being like a full-time social entrepreneur. Um, and really like thinking of this as like you can start small and like grow. So if there's like particular skills, areas of interest you have within public health or outside of public health, really think about if you want to keep that interest and skills as more of like a hobby versus pursuing it professionally. I've heard from a lot of people that like um they like have like an area of interest skills and they pursue like try to like pursue a LLC and do it professionally, and that kind of took away their passion in that particular skill set or topic. So really think about like if you don't, not everything has to be a business. So think about if you want to keep your skills or interests a hobby. Um Another great opportunity is look into and join a nonprofit advisory board or even a board of directors. And that will give you kind of the inside lens of how to run a nonprofit. And you still have a lot of that responsibility, strategic advisory for the nonprofit. Um, but you don't have to be like a full-time employee of that nonprofit. So look into if there are any nonprofits locally, nationally, remotely that are looking for board members or advisors, and consider that as in a way you could get involved. And on the next slide, I have some resources. Um, you can always volunteer for nonprofits. For example, Black Health, we're always looking for volunteers for different community-facing events that we have. You can join different community-based organizations, coalitions, and be engaged in health advocacy. The nice thing about being in Atlanta, being in Georgia, is there's so much great coalitional work happening around health equity, at our local level, at the state level. The Georgia legislature will be in session starting at the top of next year, and there will be a lot of advocacy days on the Hill. So those type of endeavors can be fruitful if you decide to stick with your current job, or want to engage in more community facing work, but not take the full plunge into social entrepreneurship. And I just wanted to end, and I'm happy to share these slides after this session with some resources. So I included resources on in the state of Georgia, how to register for an LLC if you're interested in that for-profit route, or at least like learning more about that registration process, how to apply to be a C3, so for that tax exempt status with the IRS. Georgia.org has a bunch of resources for small business owners, a bunch of educational materials, a bunch of like events, upcoming webinars. So I would look into that resource. If you're interested in the nonprofit route, there's also a center focused specifically on nonprofit capacity building in Georgia, that they also have a bunch of resources. I'd mentioned earlier, for folks that are interested in potentially being on a nonprofit board of directors, the United Way of Greater Atlanta has this program called the Volunteer Involvement Program. It's a program I did a few years ago. There's always an application for the next cohort, but it basically provides you with capacity building on what it looks like to be on a nonprofit board and just the different elements, and then connects you with a network where you're constantly offered shared different nonprofit board seats that are opening up. And then always like network, connect, build community horizontally across your peers. And I just included I know there are more, but a couple of like the peer networks that I know of. So I know there's a group me, I think it's called Young Black Public Health Professionals, something like that. And then there's also the Black Ladies in Public Health, Black Men in Public Health. They have a really expansive Facebook group that they're always posting job opportunities, advice, all of that. So thank y'all. And I'll drop my contact information in the chat, but I'll stop sharing so I could see everyone. And happy to answer any questions.
Really good. I see Mia has raised her hand. Mia, I think you're able to take yourself off of mute. Or is it Kelsey Borland that raised her hand? I can't think.
It was me.
Oh, it was you, Mia. Okay.
Yeah.
Thank you.
I really appreciate this session. Like I said, I've had my own nonprofit, and I've been able to build my advocacy and consulting career around sickle cell. So I advocate for people with sickle cell disease and just tell my personal and professional story. And I think I came across your organization when I was looking for Black health student boards to just merge public health and maybe Africana studies, and just bring more information to the students at Georgia State, and just bring sickle cell awareness to the board too. So I'd love to connect with you and see how I can volunteer and learn some things and teach some things about sickle cell as well.
Absolutely. And I just dropped my email address in the chat, but for you or anyone else on this webinar, please reach out if you want to connect and chat further, if you want any more advice. And we're always interested and want to be supportive of some of the sickle cell equity work going on across the state. I think there may be like a day on the hill coming up for sickle cell, but we're happy to show up for that. But yeah, I would love to connect further with you.
Yes, please come to Advocacy Day at the Capitol. I will let you know when that is.
Please.
Are there any more questions at all or any comments? Doesn't seem as if there are any. Well, everybody, you all have Khadijah's information. Khadijah, we are so thankful that you came and are able to just talk to everybody about your organization, the way it got started, the purpose, all of the great information, all of the detailed information, especially for starting something of your own. I think is a very important conversation to have. So I'm happy that that you were able to come out, and that anybody who's on the call that's either they have their own thing or they're thinking about starting their own thing. I hope that this was extremely helpful. We are going to, this has been recorded, so it will be a part of, we're creating a virtual catalog of all of our Public Health Power Hour series that we're doing throughout the entire fiscal year. And Khadijah, of course, we'd love to have you back, girl. You could do a few, you could do a few sessions, it seems like. So, I'm happy that everybody was connected today. And if you all have questions, make sure you please take her email down. If you have questions for me, please send me an email, schedule some appointments with me if you are interested in talking about other ways that you can do something, or just getting prepared to start something of your own if you're looking to do so. All right, guys. Well, with that, we are going to go ahead and end today's session. I will send the recording out to Khadijah and everybody that was on the call today. So I hope that you all have a wonderful rest of your day. Happy Tuesday. Happy voting to those who did not vote. And have a wonderful day. Bye.